My next guest in the speaker studio is Lisa Galligan Dawson, and now Lisa is Director of Performance for Greater Manchester Cancer Alliance. Lisa's career commenced in the private sector, where she gained her passion for service improvement. Lisa, welcome to the studio.
Thank you very much. Nice to be here.
I'm glad you've joined us, because you've just done a session, I believe, which was Innovating Today to Progress Care Quality and Outcomes. Tell us a little bit about yourself, your role, and then what that session involved as well.
Fabulous, I will do. So I think when you hear performance in someone's job title, most people think of percentages, data, figures, but really what we're about is making things better for patients. So I guess my role is about pathway transformation, pathway improvement, getting patients diagnosed and treated for cancer more quickly, easing the burden of stress, anxiety, and obviously making a difference to clinical outcomes. So this session today has been about transferring innovative practice. So what works well, how do we partner, how do we share best practice, and actually where do we need to make improvements where we know something's good but we're struggling to adopt it in other areas. So that's kind of been the focus of today.
Okay, and in terms of the sort of outcomes of the session, what do you sort of hope people will have taken away from that, and what do you hope they'll hopefully sort of implement and adopt because of sort of listening to that session?
I think we gave some really good examples of things that have worked, where we've partnered with other organisations, where we've delivered change at a system level that's made a real tangible impact for patients, and that we've been able to spread that practice. So it is doable, I guess, is probably the take home. It can sometimes feel like there's a lot of hurdles and barriers, finance, IG, working across different organisations, all of those kind of things. But actually it's doable, and when you get it right, it makes a difference for patients. And I would hope that they will take away that some of this is about us as individuals, as healthcare professionals, and the passion and drive that we need to have to make a difference, because much of this is about culture and relationships, fundamentally, and it's about wanting to get up and make a difference.
Okay, it's nice because I've had a lot of people come in the studio and talk to us about collaboration and working together, and obviously we're all striving towards the same goal, better, like say, performance overall, better service, happier clients, happier patients. And it's interesting to sort of focus on the individual. Is it like you strongly believe individuals can really make that difference?
I genuinely do. I think if you've got the right beliefs and the right passion and the right drive, you can make a difference. Where it works the best is when you've got a group of those individuals that make that change. And I guess that's one thing that we do have in the Cancer Alliance in Greater Manchester. It's relatively well known in the cancer industry as being an area of good innovative practice. We have some absolutely fabulous clinicians, and I think that together we really harness that opportunity to make a difference. But it does come down to individuals as well. If you really want to make something work, then the tenacity gets you through a lot of the time.
So it's nice that we can empower individuals, and that you really can make a difference. But like you say, when you get those motivated, talented individuals, that's where industry change comes in, and that's obviously where we can make the biggest difference. And I know we were sort of talking before. I know you've jumped into a couple of sessions earlier on today. Have you had any sort of key outcomes or takeaways from those sessions, or any sessions you particularly enjoyed?
Yeah, so I enjoyed one of the transformation sessions earlier that was around how we work better with industry partners, people that are outside of our sphere of expertise, so health innovation units, and actually that's perhaps an untapped opportunity for us. So I took that away, thinking that's actually a relationship I'm going to try and build when I'm back at the ranch. I think what was really interesting as well was to hear the different perspectives of people working in different areas, and quite often the problems are very similar, but yet when it comes to solutions we all think that we're different or our population's different. So what really struck me in that session was actually focusing on where we are similar, where we can see an alignment, and not just focusing on the things that are different, because actually there is probably a lot more that we've got in common than we've got different. And so there's an element of adapting rather than having to reinvent. And I think that's probably a really powerful message to take away today.
So it's really interesting, and I've had a look at the agenda, and obviously there's a lot of topics covered over today and yesterday. Is there anything, if we look sort of forward, let's say 5 years, is there any sort of topics or discussions that you'd like to see, sort of going forward in the future, being brought up and being discussed at events like these?
I think patient-centric change it's my passion. It's absolutely what I want to do and what I want to lead in. I think that we have to see this as an opportunity for collaboration and bringing people together. I'm not sure that we've got enough of our newer workforce coming through. It tends to be organisational leads in a lot of areas, but actually we need to bring along our next generation of managers, our next generation of leaders, for them to see the opportunity that we have for patients. Clearly, there's masses of development in digital, and that's a clear focus for the NHS. We could come up with the great ideas, but it's how they become embedded in practice that's really crucial. So I'd really like to see more of the how we do things, how we translate some of that transformation into practice and building those bridges, because I think we are in danger of technology running away before we could implement. So we need to work through what decent change management structures we can put in place to get the best out of it.
No, I totally agree. A couple of people have said that almost technology, we've been waiting for technology to catch up, and now almost technology's overtaken us in a way, with obviously recent developments and things. So it is, we are almost catching up technology. So you're not alone in those beliefs, and say it's definitely something a lot of people are focusing on and working on. In terms of any sort of good practice or examples of innovation for the NHS that you've seen, is there anything that you think more people need to know about in terms of things people are doing really well, or innovative ideas that you think that needs to be a bit more well-known and mainstream?
I think there's been some really good examples of drug-related changes, horizon scanning, things that are coming down the line that perhaps people don't always know about until they get here.
What's horizon scanning?
Horizon scanning, so looking at what's coming down the line, what's the pipeline for new drugs, what's the pipeline for new treatments, how treatments might be changing. Okay. We've seen a lot very recently where genomics plays such an important part, because we're able to then tailor diagnostics and medicines to individuals and their disease rather than a generic approach, but understanding more about the science and what new technologies and what new medicines are coming down the line, I think helps bridge the gap then between the innovation and the delivery, and that's probably been a really strong message today.
Brilliant. And I know you touched earlier on saying trying to get the younger generation or the next generation involved potentially in the future changes. If anyone was potentially watching this thinking of a career in healthcare in the NHS, what would you say to somebody thinking of that as their future pathway and career? What would you say to them?
Personally, I don't think you could have a more rewarding job. If making a difference is something that you're really passionate about, this is absolutely the place for you. And there's so many different roles in healthcare now. You can work in industry partners, you can work in business intelligence, you can work in procurement, you can make a difference absolutely anywhere. I think that for me, change management is just really exciting, because it enables you to be able to deliver things that are new and are innovative and really do make a difference.
Fantastic. And in terms of your inspiration, to get into the healthcare industry, what was it that inspired yourself to make the change into the sort of role and position you're in today? Multifaceted.
So personal experience. So I think that if you've ever been affected, certainly so cancer is really a motive. Everyone's been affected. It's something, 1 in 2 is the statistic. It's going to happen. So it's very rare that you find anyone that's not been touched by cancer. And it wasn't particularly my reason for joining the NHS. I'd worked in the private sector for a long time. I think I wanted to give something back. I felt like I wanted to give something back, so I actively chose to join the NHS. Cancer found me. I went into work one day and was told that I'd be managing cancer the day after, and that was the start of my journey. And it's absolutely my passion. And I guess sometimes a career finds you to some degree. But it was the the opportunity to make a difference, I think, and for your local population, because actually, you know, we all use our healthcare system. We'd like to think that we won't do, but, you know, we all have that need, so making it better is making it better for your friends and family.
Lisa, absolutely love your passion. Thank you so much for coming talking to us in the studio today, and I hope you enjoy the rest of the show.
Fabulous, thank you.
That was Lisa Galligan Dawson talking to us in the studio. Stay tuned, plenty more content still to come.